Talking about children and children dentistry, and you obviously see children, you do sealants, you do all kinds of stuff. What word of wisdoms do you have for a mom, for a young mom with her first newborn child? When should she bring it to a dentist? What should she do with the child teeth? What should she not do?
In our office, typically what we'll do is when the patients are having newborn, they go over all of these laundry list of questions for us. I just tell them to keep on a lookout for when the children's teeth are developing. At first, you want to clean the children's teeth with a small, a small soft rag, usually like a dish rag or something like that, to just clean debris from their teeth. As they get a little older, you can start to incorporate some brushing techniques into them. With the parent first brushing, soft bristled brush, just get them used to the motion and everything in there. As far as checkups go, we found that in our office, kids at or about the age of 3, and we really don't push the parents to have them come in a lot younger or earlier than that, simply for the fact that you get a 2-year-old and the so-called terrible twos, pretty hard to get them to sit in the chair. And a 1-year-old, they're not going to want to open their mouth. So at or about the age of 3, when they'll tend to cooperate, we take it on a slow, easy pace. At first, we just go in and count their teeth. Take a look. And we're always educating the parents on things to look out for in there. Obviously, dark areas that are pitted and look black and look like they're decayed. If that occurs, and even if they're a year or 18 months, by all means, bring them in. But if everything looks healthy and they bring them in, that's the first thing that we do. Second thing that we do, once they get used to that, and that may be on that appointment, it may be on the next appointment, or it may be a year down the line from when they first bring them in. We'll polish their teeth. Get them used to the hygienist going in there with the polishing material and polishing their teeth. As they get a little older, and we can, and they allow us, and there's room for it, we can take the radiographs to start to detect if there's any decay in between the teeth as they're developing. We're always checking the inside structures to make sure things look good, and to make sure there's room for all of the permanent teeth and the primary teeth to have room to come in. So my words of wisdom to the parents are, stay in tune with what's going on in your child's mouth. Take a look. Help them keep things clean in there. They're kids. They're going to learn. They'll be fine. If you see that anything's wrong, alert us. And when you know that they're going to sit in the chair and at least sit there long enough to open their mouth and just have us take a look, that's the time to bring them in the office.
Okay. Is it true that sometimes when a mom isn't careful and let the baby fall asleep with a milk bottle or even breastfeeding, that can have a detrimental effect to the teeth of decaying and the gums?
Oh, yes, absolutely. Anything with a sugar background or a fructose type of a substance to it is going to adversely affect the teeth, because once again, everybody's mouth has bacteria, and those bacteria thrive off of any type of sugar that's in the mouth. So, and I really honestly in my practice do not see this much anymore, as far as like what's known as a baby bottle syndrome, where parents are putting their kids to bed with a baby bottle. I think because of the educational process and because it's just been brought to light that's not the right thing to do, as far as, kind of an all-night sugar fest in someone's mouth. So, we don't see that much, but that can be nasty. And one of the telltale signs is you see dark pitted spots and marks on the teeth, and you're trying to wipe them off and, clean them off with a little wet, washcloth or tea towel or something, and you just notice that they're not going away. That's a telltale sign that there's probably some decay there.
Okay. So basically the key, a little bit, some type of key, at least what I'm hearing here is, Dr. Beda, is that, bring the child to the dentist as soon as he or she is, of course, knowing, aware of what's going on, aware that she's now somewhere else, able to follow small little commands. But nothing yet is happening. It's a pleasant visit in the end. It's like we count them, we have fun, and look forward for it again, so that, hopefully the first visit doesn't mean pulling a tooth or drilling on a tooth, because that, of course, brings with it a pretty bad stigma, I guess.
Yes, and I honestly can't remember, a situation where on a first visit we ever had to do that. Get right down to some dental work in there, because if things are nasty, then there's ways that you could just get them settled down and treated before that. And if it's really, if it's really a bad situation, well, then that's really why the specialists are out there, to help us out. But on a first visit in a routine general dental office, yes, it should be absolutely 100% pleasant for the patient, and you take it on a gradient scale. You take it and let them take it as far as what they're comfortable with.
Great. So what you're telling me is actually that parents definitely seem to have caught on and actually already pretty much do the right thing. They inform themselves. They don't let the baby sleep with a bottle. They don't, they seem to be coming to you before it's, the first pain arrives. It seems to be that they're on average doing the right thing already out there.
I think they are. I think parents are doing a great job. They're well informed nowadays. They want to help handle the kids, and I just see them doing a great job. When they bring the kids in, the kids are usually relaxed and comfortable, and very, very often have a great first visit. And if they don't have a great first visit, that's okay too. Try it again when they're a little bit older, back in 6 months, when they're going to cooperate a little bit more, and then you start from there. It's actually no big deal.
Beautiful. Thanks a lot, Dr. Bettis. Thanks for telling us all about it.
Okay, you're welcome, Helmut.